I'm Shirley Heywood. I'm a gynaecologist and I work with the International Nepal Fellowship in Surkhet in Midwest Nepal for the last 9 years. I'd been to a camp, a mobile camp in Mugu, which is the most remote, poorest district in Nepal. And we did a camp where we didn't have all the facilities that you might like. And a woman came to that camp who was bleeding. She had a large tumour and a very large uterus, and she was quite anemic and bleeding heavily. And I just decided it probably wasn't safe to operate at the camp because we couldn't give her blood if we needed to. So I asked the husband to bring her to Surkhet when I was going to be there a few weeks later. And we gave her some medicine to try and stop the bleeding in the meantime. And she arrived on the very day I asked them to come, which is unusual in a developing country. But I didn't realise the problems they'd have had, because she did stop bleeding for a while, but then she started again very badly, and she became so she couldn't walk. And her husband and 13-year-old son carried her for 2 days on a stretcher to the nearest airport. To get them tickets to get down, they sold the only thing they had, which was a cow. And then they got a helicopter, I think, down to Nepal, and then the bus up to Surkhet, and they arrived on the day. Well, we can give a blood transfusion, but we don't have a big blood bank. And your relatives give blood, and of course she'd only come with her husband. And she was white, her hemoglobin was 3. So I took her to the hospital, and as we went through the gate, it was packed, all the area outside the hospital, with the army, and they'd come that day to donate blood. And we got her 5 bags of blood, just like that. And we gave her the blood slowly, and she looked a lot better, and the day came that we were planning to operate, and we went into the theatre. And I was met by the team, and the patient was on the trolley, and they said to me, "Sorry, we can't do it today because there's no power." And it wasn't just a normal load-shedding power cut. There was something wrong with the transformer, and they said it's going to be another 4 days at least. Well, I was due to leave Surkhet fairly soon after that, and I just said, "Lord, we need power now." And the lights came on. It's the only time it's ever happened in my life, but the lights came on, and we all sort of gazed open-mouthed for a while, and then did her operation, and she did really well. And we sent her back in a plane to Mugu with money to get a new cow.